You may start counting down the days until your due date, but of course, every week of this last trimester is important because it's giving the baby more time to grow and prepare for birth. During the third trimester, the fetus gains weight quickly and adds body fat that will help regulate body temperature and provide energy after birth. So, as the woman gets closer to her due date, the healthcare provider will monitor her more closely. The appointments become much more frequent, and because of this is a great time to ask any questions that you have about labor, delivery, or caring for a newborn. As a new parent, you want to make sure that you're looking through a lot of resources to learn as much as you can before the child comes. So the third trimester is weeks 28 to birth. And so we see that this is continuing to add more body weight to the baby. The brain and lungs are continuing to develop, and in the third trimester, the baby often moves into a position in order for delivery to happen. So the mother may have trouble sleeping, shortness of breath, swelling in their feet and ankles, more frequent urination. There may be Braxton Hicks, which is like contractions, like fake contractions. They mimic the feeling of having a contraction. And then as birth approaches, it is, again, really important to learn about the signs of labor, what regular contractions may feel like, how often that happens, what is water breaking, feeling that increased pelvic pressure from the baby's weight moving within the womb. So, and so the fetus is growing, continuing to grow in length and weight. The brain is also rapidly developing at this time. The fetus can see and hear many things happening outside of the womb. Obviously, they can't see like through the womb, but they can sense the stimuli, the light, the sound, the muffledness of the sound, things like that. Most of the body's internal systems are well developed at this point, but the lungs are still maturing. For month 9, this is weeks 33 to 36, and the fetus is continuing to grow, as has been each month. The lungs are almost developed, and the brain is continuing to also grow. The stage is mostly about putting on like the final touches on growth and helping the fetus to prepare for life outside of the uterus. And then we have month 10. So this is weeks 37 to 40. All women are different in where they land in having their delivery. So in the final weeks of pregnancy, labor can begin at any time. The fetus is usually moving into a head down position to prepare for birth. As the fetus drops lower into the pelvis, a woman may feel more pressure and discomfort. The healthcare provider may ask you to do kick counts, which is feeling the fetus's movements, tracking how active the child is. And this can kind of show how healthy the baby is or how the child reacts to stimuli. The end of the pregnancy, the fetus is usually about 18 to 20 inches long and weighs about 7 to 9 pounds. But of course, it can vary. Can vary. All right. Well, that is the pregnancy, the third trimester. Next video, we are going to explore what happens for labor. Thank you for tuning in. I will see you in the next video.